Hypertension, commonly referred to as high blood pressure, is characterized by a systolic blood pressure between 120 and 139 millimeters of mercury or a diastolic pressure between 80 and 89 millimeters of mercury, and is classified as prehypertension. Blood pressure is considered normal when the systolic blood pressure is more than 90 millimeters of mercury but less than 120 millimeters of mercury, and the diastolic blood pressure is more than 60 millimeters of mercury but less than 80 millimeters of mercury. Hypertensive crisis, which is a medical emergency, is present when the systolic blood pressure is over 180 millimeters of mercury or the diastolic blood pressure is over 120 millimeters of mercury. Signs and symptoms. Many individuals with hypertension may not experience any noticeable symptoms. However, they may occasionally report headaches, visual changes, dizziness, chest pain, tinnitus, and facial flushing. Interventions. Treatment aims to focus on lifestyle modifications and pharmacological interventions. The primary goal is to lower blood pressure and mitigate the risk of complications. First, implementing dietary changes and promoting exercise are crucial steps. The dietary approaches to stop hypertension diet, known as the DASH diet, is recommended to reduce dietary sodium intake and aid clients in achieving a healthy weight. Teaching clients about moderating alcohol and caffeine consumption, encouraging smoking cessation or avoidance, instructing relaxation techniques, and eliminating unnecessary medications that may contribute to hypertension, such as NSAIDs, decongestants, and corticosteroids, are also essential components of hypertension management. Pharmacological interventions are tailored to meet each client's specific needs. The four main drug classes used to treat hypertension are ACE inhibitors, beta blockers, calcium channel blockers, diuretics. Main causes. There are two types of hypertension: primary hypertension, which is the most common, and secondary hypertension. Primary hypertension, also known as essential hypertension, has an unknown cause and is not curable, but it can be managed. Examples include race, African Americans, high intake of sodium or alcohol, smoking, low levels of potassium and vitamin D. Other factors contributing to primary hypertension include family history, advanced age, high cholesterol levels, excessive caffeine consumption, obesity, lack of physical activity, and sleep apnea. Secondary hypertension is caused by other disorders or conditions, such as cardiovascular disorders, renal disorders, endocrine disorders, pregnancy, and certain medications, such as estrogen and corticosteroids. Potential complications. Untreated hypertension can lead to severe complications, including stroke, heart failure, hypertensive crisis, renal failure, and visual impairment. Laboratory assessments or diagnostic test. Let's delve into the crucial laboratory and diagnostic tests for monitoring hypertension. As a nurse, it is imperative to regularly monitor the patient's blood pressure, record their weight, and assess for any visual changes or signs of retinal damage. Additionally, a chest X-ray should be conducted to check for cardiomyopathy. Assessment for cardiovascular changes, such as jugular vein distension and dysrhythmias, should also be performed. The nurse must further evaluate the patient's neurological status and check for any alterations in renal function. Education. What are the essential teachings to impart to your client? The nurse should emphasize the importance of complying with the treatment plan and adhering to medication as prescribed. Patients should be advised not to discontinue medication abruptly to prevent severe hypertensive reactions. Additionally, stress the significance of following a proper diet and exercise regimen, avoiding foods high in sodium and cholesterol. Instruct the patient and their family on the importance of monitoring blood pressure regularly and keeping a diary of readings. Furthermore, advise the patient about the actions and potential side effects of medications and when to contact their physician. The nurse must also emphasize the importance of follow-up care and instruct the patient to avoid over-the-counter drugs. Encourage stress management and relaxation techniques, while advising the patient to rise slowly to reduce orthostatic hypotension and to sit or lie down if dizziness occurs. Moreover, inform the patient to include potassium-rich foods in their diet, such as citrus fruits, bananas, and green leafy vegetables, especially if taking potassium-losing diuretics, and reassure them that medication side effects may diminish over time.